Dry eye represents the largest patient group in eye care. Now with breakthrough technology, the LipiFlow system offers a clinically proven treatment solution that addresses a root cause of dry eye. According to the Tear Film and Ocular Surface Society, meibomian gland dysfunction is likely the most frequent cause of dry eye disease.
LipiFlow is really a remarkable, it's simple but brilliant in terms of how the concept was kind of formulated by Dr. Korb and sort of brought to a real-world practical reality.
LipiFlow applies heat to the eyelid from the inside. It's really impossible for us to do that by any of our existing methods. So we heat the secretions that are inside the entire gland. This allows them to flow, and we think it's partly because of this that we get sustained flow from those glands and sustained symptomatic relief for our patients.
And certainly this is very exciting not only to the patient, but to us as clinicians, because again, it did not require ongoing treatments with any other types of regimens. It didn't require a prescription medication that they were on. Simply an outpatient procedure that they received in my office enabled them to have improved comfort.
In clinical studies, the average meibomian gland score for patients who received a single LipiFlow treatment more than doubled at 2 weeks and continued to improve at 4 weeks, in contrast to those who received daily warm compress treatments. In fact, those patients who received daily warm compress treatments were crossed over to LipiFlow at 2 weeks and showed improvement in average gland score by 4 weeks.
This is really one of the hot new things in ophthalmology, something that we're going to really kind of change the lives of patients that until now really we've had very little to offer.
This is ready now for patients that have been waiting for this.
This is really a new step in the direction of assessing the quality of someone's tears.
As you know, tear film is made up of the mucin layer that adheres to the eye, the aqueous or water layer, and the lipid or oil layer, which lubricates and prevents evaporation. Much of the focus of dry eye treatment has been on supplementing the aqueous layer with drops and ointments. However, up to 86% of patients with dry eye symptoms actually suffer from evaporative dry eye, which is caused by an obstruction in the meibomian glands that leads to a deficient lipid layer. Not only is meibomian gland dysfunction prevalent, but is often chronic and progressive.
LipiFlow is entirely different from any other treatment we've had before for meibomian gland disease because it gives exactly the treatment that's needed right where it's needed.
And LipiFlow really has done a great job at standardizing that. So you have a directed heat application at the right temperature, at the right location, for the appropriate amount of time, and that's standardized.
By removing the obstruction in the meibomian glands, patients can achieve symptomatic improvement.
And we have a way of treating it that gives both effective and sustained relief.
To be able to provide not only a way of identifying it and validating it, but actually treating it or providing an option that can give them relief is really exciting.
During clinical studies, on average, patients achieved symptomatic reduction following a single LipiFlow treatment based on the Ocular Surface Disease Index, or OSDI.
You think of the large number of patients that this could apply to, it's very, very appealing technology.
The treatment of meibomian gland dysfunction and evaporative dry eye has always been an enigma. And the reason is, again, because the doctor couldn't see it.
We see so many dry eye patients who have some degree of meibomian deficiency, some degree of aqueous deficiency, and knowing exactly where to direct our treatment is fairly difficult when there's guesswork in the equation.
The LipiView Ocular Surface Interferometer creates a digital image of the tear film during a non-invasive office exam. physicians can assess meibomian gland dysfunction to determine the appropriate course of treatment.
Sort of a satirical irony on the fact that no matter how good you are as a clinician, you can't see most of meibomian gland dysfunction because it's inside the gland. And it's a question of whether or not that gland is secreting at any given time.
The general theme is that there were limitations, and now that this type of treatment is available, which is again a more standardized way of providing some of the first-line therapies, we have been able to maybe get a situation where we can be more applicable for a greater percentage of the population.
The LipiFlow treatment can be used at any stage of the patient's disease. Therefore, it should not be considered solely as a last line of treatment. The LipiFlow system, a simple in-office procedure, has been clinically proven in a randomized, multi-center clinical study for treatment of meibomian gland dysfunction.
It did not hurt. It obviously felt a little unusual, but it was actually an easy treatment to undergo.
It felt a little bit more like it was a spa treatment than it was a visit to the doctor's office. That was kind of how it was intended. There was music set up in the room.
It was very easy. I didn't feel a thing. No pain, no nothing. Nothing. I walked outside and I'm like, well, holy cow, you know? I could actually look up like this without my sunglasses on.
The thing that the LipiFlow offers is you're going to where the problem really is.
Past treatments, such as warm compresses, can be less effective due to the wicking effect of the vasculature. When applied from the outside, heat is diverted into the surrounding tissue and away from the affected glands. The LipiFlow activator is inserted by gently tucking the scleral interface between the upper lid and the ocular surface temporally, then guiding the lower part of the scleral interface under the lower lid and centering the activator by closing the lids. The LipiFlow system uses heat and a 12-minute optimized pressure sequence to remove blockages in the meibomian glands. By heating the glands from the inside, blockages are liquefied. Gentle pressure is applied from outside the lid from the base of the gland to the gland opening, removing blockage and flushing dead cells from the gland.
Well, LipiFlow works by, again, heating the base of the meibomian glands from the back part of the eyelid and at the base, so it directs the heat directly to where it has to go. The design of the eye cup that has an inflatable bladder that produces pulsatile pressure, and that causes evacuation of the contents. So you've got a situation where you're liquefying the contents and then allowing them to be expressed very easily. I mean, when's the last time you heard a dry eye blepharitis patient just be effusive about how good their eyes are feeling? And I've never experienced that until LipiFlow.
In clinical studies, the average meibomian gland score for patients who received a single LipiFlow treatment more than doubled at 2 weeks and continued to improve at 4 weeks, in contrast to those who received daily warm compress treatments. In fact, those patients who received daily warm compress treatments were crossed over to LipiFlow at 2 weeks and showed improvement in average gland score by 4 weeks.
LipiFlow is going to give us a chance to have a sustained method of giving relief to these patients through a simple office procedure that just takes a few minutes.
Most of them, over the period of the first week or two, definitely noticed a significant improvement, not only in their comfort level, but many of them in their level of vision as well. This will become a major part of my practice.
It certainly has proven to be an amazing therapy for meibomian gland dysfunction that leads to dry eye.
Your patients are going to ask you for it and then say, well, can I have this treatment done? And you're either going to say that yes, I am performing this treatment, or you're going to refer them to somebody who's performing it. But I think you can't avoid the fact that it's going to be, hopefully for a long time to come, a major part of the way we treat dry eye and ocular surface dysfunction.
It makes sense clinically, and I think to get over that hump of resistance, you know, ophthalmologists want to know, clinically, does this make sense? And absolutely we can see and know from our experience that it makes sense. To be able to provide not only a way of identifying it and validating it, but actually treating it or providing an option that can give them relief is really exciting because it fits within our whole practice mindset and milieu.
So having an alternative treatment for meibomian gland dysfunction that will give not only an effective treatment but a sustained benefit is a huge advantage to us.
This is ready now for patients that have been waiting for this.